I believe it's actually more difficult to be the caregiver of a person with cancer than having cancer yourself. There are a number of changes in your life that you should expect. Certainly with prostate cancer, one of the most significant initial changes is going to be a change in your sex life. It's not going to be the same, and this often puts additional strains on relationships with spouses and partners. I think also, depending upon the general physical and medical condition of the survivor, that will add additional burdens on a caregiver. I think caregivers have a responsibility to make sure that they also care for themselves, and it's very hard to do that. That means you have adequate time off for yourself. You need an opportunity to refresh yourself. And also you need to find a way to understand what your own personal needs are, because you remain a person yourself with wants and desires and pain. It's probably very hard. I know it's very hard to watch somebody who you love dearly go through a cancer experience, to watch the strains that they have, to watch the pain that they go through. But the important thing is to find other people who you can spend time with, to do things in order to refresh yourself. That is a requirement for being a good caregiver. It's also very important for a caregiver to be comfortable asking other people for help. If you don't ask for help, you're going to become bitter and frustrated and angry yourself. And there's no good in that, because you're not going to be able to provide the care that your cancer survivor is going to require. So don't be afraid and don't be shy to tell people what you need.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.